Yeah, I think that's one of the things that when you talk to an epidemiologist, they'll tell you, here's how you slow the spread of the virus. But there's all sorts of other costs, health costs that go along with that as well. So for example, you may have read the weekly mortality and morbidity report that the CDC puts out in August that described a survey they did around mental health and how 40% of Americans were having some sort of mental health issues, including 25% of 18 to 34-year-olds who had considered suicide. Right? And that number is up significantly from previous years. Overall, I think it was over 10.6% of Americans had considered suicide versus like 4% the previous year. And certainly we saw those same sort of health implications and costs with the survey that the Kim Foundation did, and they surveyed local law enforcement in Douglas and Sarpy County and came back and said that suicide amongst people under the age of 20 had doubled from 2019 to 2020. And by the way, at the time, that was 10 times the number of coronavirus deaths. So we also know that our drug overdose deaths are 13.6% higher in 2020 versus 2019. And that's preliminary numbers. That number is going to continue to go up as we get more information. So there's all these kind of hard costs. We also know that we're likely to have seen more domestic violence, more child abuse. These are all the other sort of health costs that are associated with this pandemic that are not so widely known as, obviously the very visible ones of the fatalities we've had from coronavirus and the personal tragedies that the families have suffered along that. And then if you set aside even those kind of health costs, you can think about the toll it's taken on people with regard to, and this ties into the mental health, but you can think about the economic toll it's taken on people as they've lost their jobs, had to dip into savings, that sort of thing. That's also got a toll on our state.